John Bozica along with you, 1480 WHBC, and we come to you live today from OMNI Orthopedics in Belden Village, and we've so far talked to Dr. Anthony Pence about reconstructive hip and knee surgery. We talked to total joint nurse Lisa Hazen, and now we bring in Dr. Kelsey O'Connor, who is going to speak with us about how she specializes in, physical medicine, rehabilitation, and pain management. I had the notes there. I just had to figure out how I wanted to say it. Sometimes you have the thoughts, and then sometimes you don't know how to say them, and that's part of the problem of being on air. But Dr. O'Connor, for those that maybe might not know what it is that you do,
sure.
And thanks for joining me first.
Well, thanks for having me. I'm happy to be here.
Kind of tell me what it is that this all encompasses for you, and what all are your daily tasks?
Sure. So I've been in OMNI Orthopedics for about 3 years now, and my role here is it's non-surgical. So I'm not trained as a surgeon at all. And what I do is I try to approach common musculoskeletal, back pain, neck pain, shoulders, hips, knees, from a non-surgical standpoint using a really active approach, physical therapy, which we have in-house, injections, and even leading up to more invasive procedures that aren't surgical, that all focus on getting you back to doing what you want, really pushing that functional recovery aspect of allowing you to deal with any flare-up of back pain. If you've been gardening, mowing your lawn, it's the season now for that. Or if you fall on the ice and flare up the back, or arthritic pain, all these different generators of pain, trying to kind of tailor a personal kind of rehabilitation-focused approach without relying on opioid medications long term or right to a surgical option. Now,
in terms of not taking the opioids, I know that's something that's really started to grow in the last 5-6 years here. I'd feel like since the opioid crisis has
Absolutely.
really hit us. But I guess what are some of the alternatives then to doing that and not taking those things? And is there still medicine that can be given that's maybe new on the block?
Yeah, so there's a lot of different classes of medications that can be used to try to help with whatever type of pain you're having. Frequently in orthopedic practice, we see a lot of musculoskeletal pain, muscle spasm pain, arthritic-driven pain. So we use a lot of non-opioids, anti-inflammatories, nerve-stabilizing medications when needed, muscle relaxants if needed. But my focus is really focused on using physical therapy and active movement to kind of actually fixing those anatomical changes and issues, and using medications or injections of steroids to help facilitate that active movement and recovery.
I heard the term come up when we were in the break there, and I heard that, and it was CBD.
Yeah.
And I know a lot of people are always saying, well, is CBD oil useful? Can it actually work? So I'll ask somebody who probably deals with it now.
Yeah, absolutely.
How does it work when it comes to pain management? Because I've wondered myself.
Sure. Well, the thought is in that there's certain types of receptors in our brain that have to do with the pathways of pain, and some of those are called cannabinoid receptors, which CBD oil is a cannabis-based derivative. And that is from the marijuana plant. Now, CBD oil will have, or should have, that THC component out, which is the part that gives us the high, or kind of that elative property in the brain. So the theory is that if you can use this oil, some people use it orally as an oil or topically, it can help reduce pain, inflammation. It also, some people tout it as other side effects with anxiety, sleeplessness, insomnia as well. But again, at this point, the CBD oil is not incredibly researched robustly yet. And it is, in my opinion, still considered a supplement, just as if you were going to take turmeric or glucosamine and chondroitin for joint pain. When a patient brings it up, I usually have a long kind of consultation reviewing their medications to make sure there's no interactions on that end, ask them what their goals are and what they'd like to use it for, and then trying to guide them to a reputable place to purchase it and how they'd like to use it. Because, again, there's no regulation on this. It's a supplement. So sometimes it'll be 10%, 14%, 28%. And what does all that mean? What does some people need more or less? That's where I can kind of help to guide them in it. But, I'm very open to using kind of those adjuvant type of medications to help that doesn't rely on just pain medication, which, especially if it's coming from spine pain, like spinal stenosis, arthritic, degenerative disc disease, all those issues, those opioid medications, just inherently by how they're engineered, are not designed to help improve that pain. They're just masking the pain signal in the body.
Sure. Dr. Kelsey O'Connor joins me. She is a board-certified physician specializing in physical medicine, rehabilitation, and pain management. Dr. O'Connor, when you mention marijuana, that always gets the ear going, you know, when you hear that. But I mean, have you ever prescribed that for people that are looking for pain management?
Well, I don't actually, I'm not licensed to prescribe the
Sure.
medical marijuana, so I don't use that as part of my practice. In a more traditional medical-based pain management, that may be an appropriate treatment for someone who has chronic intractable pain, maybe from cancer or traumatic event, and I think it has its place. That's not the kind of practice or focus that I'm kind of running here. And we have, you know, other pain management medicine physicians here who could consider that. But I stick more with the things that are going to help but not have as much cognitive side effects.
Sure.
Because again, my goal is to get you moving and active. So, you know, I don't want to give you something that's going to make you too relaxed, so to speak.
Well, and is that probably how things are, and I'm just guessing here, but I mean, is that how things are different at OMNI compared to other places, that they're going to get you up, get you moving, get you going from day one?
Yeah, I think that one of the reasons I joined this practice 3 years ago is their commitment to patient safety and efficacy of treatment. I wouldn't have a job here if our regional spine team here didn't see the just kind of advantage of having someone who can help you through the early stages of managing your pain or your back issues, and not just relying on, oh, you just have to have surgery and that's the end of it, because it's a range of treatment. And sometimes surgery is a necessary one, but quite often it could be the last one that's needed.
When operating on the spine, you know, I know that, as we were saying about hip replacements and things like that, like there was always such a long period of time to wait before you could be active again. How quickly is someone active now when having an operation on the spine?
Well, I don't do surgery, so I can't really speak to the surgical recovery. But in terms of my injections, the recovery time is quite quick. So if it's injections or blocks or whatever procedures we can perform and help for the spine pain, usually the day of, you may be a little tender and kind of just feel a little bit off. But by the next day and then 48 hours after, we tell people to get back to the same level of activity as you've been. And by about 1 or 2 weeks after, we can start considering if they're having improvement, progressing their activity and start to really improve their chronic pain issues.
And that's after surgery on the spine, which is just
well,
wild.
Injections, not surgery.
Okay.
So I always joke with my patients. I said, I'll make you my pincushion, but I'll never cut you.
Okay.
So.
Okay. Big difference there.
Big difference,
really
yeah.
As a whole, rehabilitation, how has it changed the most in the time that you've been in medicine?
Well, I think some of the biggest changes have just come with the advancement of technology that we can use to non-surgically help improve back pain. So one of the things that people are becoming more and more familiar with are ablations type of management for long-term back pain. And that's something that is a process to kind of determine if you're a candidate for that. But there are people who get 6 to 9 months, if not years at a time, of relief with a non-surgical approach to help with their back pain, and it helps them stand up and walk and you know, do all the things that they want to do to a much more tolerable degree. And I think that, you know, that approach with it is called neuromodulation as well, with spinal cord stimulator trials and selective treatments in that area can also be almost life-changing without having the need to have you know, a really in-depth surgical approach.
It's talking with you, with Dr. Pence, with Lisa this morning, you know, as we're joined by Dr. Kelsey O'Connor. She's a board-certified physician specializing in physical medicine and rehabilitation and pain management. It's just amazing to me how quickly we're able to adjust things now and how quickly we're able to use medicine to treat things. Do you really feel that's something that's started to happen more and more within the last 10 years now, or is that kind of a growing trend over the last however many years? Like, how long has that been that we've been quicker with things like that?
Well, there's always a process with kind of trying to incorporate medical procedures and things in that regard. And so that always will take time because you have to be safe and you have to be researched. But, the area of low invasiveness approach to spine pain is it's growing every day. And there are more and more things coming out every day. They're researching more and more. But it does take time because you have to make sure that it's safe and there's no disc replacement yet, or there's no great stem cell treatment yet that'll help you regenerate your cells and get rid of all the arthritis. But, in 10 to 15 years, who knows, that the biologics and the thought of using stem cells may be a more of a first-line treatment.
How has your job changed during the pandemic?
Well, obviously, when we were completely kind of in the lockdown time, we had to stop doing these elective procedures, which these back procedures are. No one has ever died from back pain alone. It cannot end your life like the virus can. So we had to listen to our officials and our healthcare providers up top, and it did slow it down quite a bit. I mean, and that's appropriate. I think also every patient now, we have a kind of deeper discussion about certain medications, if they may or may not affect your body's ability to fight infection, and we have to kind of weigh the risk versus benefit. If it's severe intractable pain and we want to try a treatment, there's always side effects to anything that we put in the body or do to the body. And so, we've been good about wearing masks, washing hands, that kind of thing, and following those guidelines with the CDC and health departments. But, for the most part, we've still been able to help because people's pain didn't stop just because this virus came about. And so I couldn't stop either.
Dr. Kelsey O'Connor, board-certified physician specializing in physical medicine and rehabilitation and pain management here at OMNI Orthopedics. Dr. O'Connor, thanks for joining me.
Thank you. Appreciate being here.
Absolutely. We'll take a break. We'll come back, and we'll be joined by Dr. Matthew Stonestreet, who, again, is a surgeon specializing in adult reconstructive hip and knee surgery. That when we come back.